marijuana is gaining support, but what if the patient is a child? In July, a 7-year-old was diagnosed with leukemia. A few days later, she joined Oregon's medical marijuana program. Her mother says the cannabis oil helped put the cancer in remission. But is it safe? We asked CNN's chief medical correspondent, Dr. Sanjay Gupta. Sanjay?
Well, Wolf, the question of safety is the first one that comes up every time you talk about this. And as you might imagine, it is difficult sometimes to get some of those study results back. In the United States, for example, it's an illegal drug that we're talking about. So it's hard to do the studies, and it's especially hard to do them in children. So a lot of the data that we talk about actually comes from other countries. So, for example, there was a study out of the Netherlands looking specifically at adolescents who smoked marijuana, or who took marijuana, and comparing them to people who were adults. And they did find that if you smoked or took marijuana before a certain age, it was more likely to have a long-term impact. So, for example, these children who started during average age of 8, but teenagers as well, by the time they were 38, they had a loss of about 8 IQ points compared to the general population. It's a lot, not that much, depending on your perspective. But with adults, they did not find the same long-term impact in these studies. With regard to Michaela specifically, she has this treatable form of leukemia. She's got about a 79–80% chance of putting this into remission. She's taking this medical marijuana to try and alleviate some of the symptoms, for example, the nausea that's associated with chemotherapy, and also the pain. Marijuana can be especially effective for treating what is known as neuropathic pain. That's the shooting pain, the pins and needles sort of feeling. The question that doctors want to know is this safe? Is it effective? Is it more effective than what else is out there? Sure enough, are there other medications for nausea? Zofran, for example. You can even take a THC, which is the active ingredient in marijuana, in a pill form known as Marinol, and that's something that's FDA approved. But again, this is going to be a decision between patient and their doctors. Michaela, by the way, isn't the only one. In the state of Oregon alone, out of the 2,200 people who are on the marijuana registry, 52 of them are children. It is now legalized for medicinal purposes in 18 states and in 2 more states for recreational purposes. So this is an issue that's going to come up again and again, and hopefully we'll get a chance to continue to talk about it.
I'm sure we will, Sanjay. Thanks very much. Let's hope this little 7-year-old Michaela Comstock is going to be okay.